this side will crumble quicker than the other side. Agreed? Right? So, if you look at an x-ray, if there's more weight or more pressure being put on one joint, or this is an MRI, but more weight or more pressure being put on one joint, that joint will degenerate quicker than the rest of it. And that is a major problem. You start to get disc bulging into the spinal cord, and then you can have all sorts of horrible problems. Okay? These people generally crawl into my office. Or they can't come in at all and they need to get surgery. So that just makes sense. Structural instability, if you really look at how your structure is and how you're standing up. And for orthodontics, it's the same thing. You know, structure is a lot with orthodontics, right? And how the teeth are actually put together and how structurally sound they are. So repetitive injury, how many people work on a computer? I'm sure you guys do a lot. If you look at her neck and how straight it is and look at this x-ray, does that look good? Does it? Her head is really far forward and her neck is really straight. So this puts a lot of pressure here in the base of the skull. See how close her first vertebrae and her skull is? Really close. And it puts a lot of pressure up here in the upper back. So the upper back will begin to get real tight, spasming, it'll start to get inflamed, and then they need to come see me. But they need to come see me before then. Did you know the average American right now watches TV for 8 hours a day? You guys know that? I looked that up for you, right? I believe that. 8 hours? Crazy. Now the next question is, everybody's comparing. Wait, how many hours do I watch? I watch this show, I watch Lost, American Idol. Oh man, I'm 8 hours. But the average American watches TV 8 hours a day. How many people sit up straight on their couch to watch TV? Nobody, right? So they're laying crooked, their heads all smashed against the side of the couch, their heads up like this, they're flopped down sideways, right? Nobody wants to sit straight up. But you gotta pay attention to that because that can develop issues over time. And those are the type of things I'm talking about. Computer work, a lot of data entry type positions, they look at a computer 7 to 8 hours a day, and they're sitting and they're leaning forward. So you really got to think about ergonomics there, and where should the computer screen be? Should be back? Make sure they're not turning a lot, because over time, repetitive injury that'll develop problems. This is my favorite picture. She is just blown away by the stuff I'm saying today. Blown away. I don't know why that computer has some sort of airflow on it. But anyway, so you got to think about that. You got to watch that. Now, does that look good? No, it doesn't. How many hours a day do you sit like that? Yeah, when Ross was working on me, Dr. Dennis was working on me, I kept thinking that. I know it's sad, but I was like, you're leaning over a lot. But you can develop a lot of pain up in the neck. What about that? You guys see that a lot, don't you? Now, when you go back to the office, you're going to start nudging the docs. Hey, this chiropractor is all right, so you just got to be aware of that. So there's preventative techniques that you can do to really keep that from becoming an issue. So is this good posture or bad posture? Obviously, it's bad posture. It can really affect your spine over time. Okay? Now, don't get me in trouble. Don't start yelling the doc. All right, major traumas, falls, car accidents, those type of things will develop degeneration quicker. So why should you get treatment? Well, like the degeneration scale I showed you a minute ago, this is an x-ray of somebody's spine, it becomes very, very straight. You see how straight that is? That should have a curve. It should look more like this. Okay? So if you have your spine very, very straight, let me ask you this question. What gives more, a curve or something that's straight? A curve, right? It's more like a spring. That's the way your spine should be. It should be curved. So this, over time, will develop into this. Now, do you guys see what's going on there? Can you see that on the screen? How many people look at cervical x-rays all day? Nobody, right? But you can still see what's going on here, can't you? Yeah, it's compressed down. There's bones growing off the front. That's called degeneration. So bone spurs, disc space loss is what we're looking at. When you lose disc space, it compresses on the nerves that come out of the spinal cord. And that's where you get finger numbness and tingling and stuff going down your arms. But you can't tell me that that person never had a symptom until they had finger tingling or, major headaches or anything that? Obviously they did. So that's what I'm saying, prevention, prevention, prevention. So 4 parts of chiropractic care. 1 is pain reduction. That's the first thing we look to do, reduce pain, because that's generally when I see somebody, obviously, when they have a lot of pain. Second part is correction. So once we reduce pain, then we really try to correct the area as much as possible to stop that degenerative process. Even reverse it at some point, right? But if you get too far down the phases, you can't reverse it. Just like your teeth. Once you get to a certain point, the doctor's going to go, we got to take that thing out and replace it, right? Can you replace your spine? No. You can use it, but that's not a real great option unless that's the only option you have. So if you can prevent it, don't you think your lifestyle would be a little bit better? Right? I talk to people about this all the time, patients. They come in, wouldn't your lifestyle be better if you're sitting on the couch and somebody says, let's go outside and play with your grandkids or kids, and the first thought in your head is, great, let's go. Not, I don't know, it might hurt my neck. And I hear that a lot, It affects my lifestyle. I need to do the things I want to do. All right, the third thing we look at is stabilization. So once it's corrected, we want to retrain the area to where it becomes stable, to where it's not going to go back to where it was. And then the fourth thing is wellness. So make sure that you are preventing future problems. That would be like somebody coming in every 3 to 6 months for a dental checkup. Same thing with me. That's what they should do. All right, so pain reduction. I'm going to go over those 4 parts. Pain reduction, we remove subluxation. Now that you guys are experts on subluxation, right? So you can repeat it all, right? Remove subluxation. We do have to have more visits because obviously there's more things to get rid of. More inflammation, more restriction, those type of things. Modalities are used more often. You guys know what modalities are: muscle stem, a lot of physical therapy type stuff, hydrocolloid packs or heat packs, ultrasound, that sort of thing. That is what we use more often at that point to try to relieve pain as much as possible. Then we move into correction. So we implement rehabilitation. What that means is we start giving stretches and exercises to increase the curve. So if you look at this right here, this is before. This green curve is where your spine is supposed to be. The red curve is where theirs is. So obviously it's becoming a little too straight. Afterwards you can get a little bit more of a curve. Does that make sense? So this is the stuff that we work on. If you're in phase 1 or less. If you're in phase 2, that's where the bone spurs are, you can't go backwards anymore. And that's why I talk about prevent, prevent, prevent. All right, so then we also remove subluxation. Stabilization, visits are less frequent because I know this common misconception. Once you go to a chiropractor, you always have to go to a chiropractor. You guys ever heard that kind of thing? Well, in our office, it is true to a point, but in our office, we create a treatment plan and you get maximum medical improvement. Once you get to that point, then look, you are not on a corrective care plan or stabilization, you're on a wellness plan. So it's a good idea to keep coming back every 3 to 6 months, but you don't have to. It's just like dentistry. How many times do patients follow your treatment plans exactly? Maybe 1 a year, right? Exactly what you want them to do, maybe. So what I'm saying is the reason why we educate in this is so when people see that, wow, I'm becoming restricted, maybe I should go get checked out, and that's when they go get checked out. And it's generally around every 3 to 6 months. So removing subluxation and reviewing patient compliance of exercise that we have given to increase that. So my main goal is minimum treatment, maximum results, and then what will result in that is cost effectiveness. Okay? So I don't want somebody to come back once a week forever. That's not my goal. My goal is let's give you the absolute minimum treatment you can get to get the maximum results out of it. And that's why we give a lot of exercises to take home. Okay? If people would do them properly, it would work a little bit better. But the patients that do them properly really have good results. And then wellness, like I said, 3 to 6 months, we remove subluxation, maintain a healthy spine, and then we review the rehabilitation exercises. There's more there that you can see. Okay? So that makes sense, doesn't it?
Yes.
Right? Yeah. All right, let's go into TMJ real quick. So what do chiropractors actually look for with TMJ? There's a few things that we look for that naturally help. So limited range of motion, if one side is not opening as well as the other side, if one is opening least or last, so if one side opens first and the other side drops down, or if it doesn't open as far, that's what we really look for. And it has a lot to do with the medial pterygoid muscle.